Haha, you are live. This always feels a little bit like, are we live? We don't know.
Right.
We
You
can't
can't
really
tell.
tell. Someone's saying that we are. I'm Adrienne Wood. This is Dr. Leslie Miller. Super excited to be here tonight on a topic that I really have never tackled before. We're here to talk about hepatitis C. And tonight, Dr. Miller and I are going to do a little Q&A session. And then hopefully we'll have a little bit of extra time so that some of you, like Kara, can ask some questions yourself to Dr. Miller, who is the head of a major liver clinic in the United States and a professor. So I want everybody to know tonight's session is sponsored by MedIQ through an educational grant from AbbVie, which is awesome. And both Dr. Miller and I were invited by MedIQ to take part in this conversation, and we are receiving compensation from MedIQ for our participation. But we're really excited, and I'll tell you why. I was just telling Dr. Miller, sort of behind the scenes, that hepatitis C is not something has ever really been in my hemisphere, but I lost a brother, my only sibling, to a really rare cancer. And as I was reading about hepatitis C and seeing that it can kill you, but that you can test and find out that you have it and save yourself, I was like, holy cow, if one person gets tested for Hep C and their life is saved, this is worthwhile to me. So just really feel passionate about that. And as I put up a post on Saturday, and I was really curious to read these comments. And I'm going to read a couple to you, Dr. Miller, and to everybody else. When you think, well, does Hep C really affect me? Here's one from Michelle Callahan. I received a heart transplant 2 years ago. My donor had Hep C, a teen who was a drug user. I took one pill a day for 12 weeks. I actually showed not detected after 2 weeks, but continued to take the medicine for 12 weeks. I'm cured and it will not return.
That's wonderful.
So here's a person that needed a heart, right? And got it. Here's another one. My daddy received the gift of life via new liver last year, and his donor also had Hep C. Praise God for the cure. He's thriving and living a full life on the daily.
It's wonderful.
And then this is the last one, which is uplifting, but my mother died due to complications of Hep C in 1999. She was involved in several trial medications. I like to think she was part of the reason there's help for people today. Get screened. It could save a lot of heartache.
Absolutely.
And I think you would probably agree with that. So Dr. Miller, tell us a little bit about yourself.
Sure. So I am a general internist and practice at a major academic center in Atlanta. And my clinical work is at our safety net health system in Atlanta as well. So I started doing general internal medicine, primary care doctor first and foremost, and then just got into hepatitis C just because the points you made already, it's such a compelling disease to pay attention to, and a really exciting disease. I got involved in this back in 2004 when we didn't have great treatments. So I've been doing it for many, many years and really have had the opportunity to kind of over this time span watch these major sea changes in the field, and been privileged to be able to go from a point where we could treat very few people and cure even fewer to now we can treat almost everybody that walks in the door, qualifies for treatment. We can cure 95% plus of people with hepatitis C. And so it's just been a revolutionary time over the course of my practice, and it's been really exciting and a privilege.
Yeah, I would think so, because there are not many illnesses that we can say that about, that you've like ridden the wave, and been able to see that. Wow.
Exactly. And I think sort of the counterpoint to, I do primary care as well. And, there's so many diseases we deal with in primary care, like hypertension and diabetes and obesity, that we can't cure, and we can treat and we can counsel and guide and take care of, but there aren't cures. And so, being able to treat something where there's a cure, it's like, I always tell people kind of my favorite part of the day when I get, all the results back of the undetectable hepatitis C viral loads. It means people are cured and get to make those phone calls and say, hey, the treatment worked, you're cured. It's like the most gratifying thing in medicine. So I always, tell other folks, we really need more providers who can treat hepatitis C. There aren't enough, given the volume of patients with hepatitis C. And I always tell folks, especially general internists, because there's a push to get more primary care folks treating, is that, it's such a gratifying thing to do. And,
Right.
it'll be the best part of your day.
Yeah. Yeah. So why is talking about it so important? What are your top two reasons?
Yeah. So if I can make a top three, I would
You
say
can.
that,
I'll let you
yes,
know.
thank you. I always kind of open any talk about hepatitis C saying that it's common, deadly, and curable. So I think
Mm,
that kind of triad makes it really compelling to pay attention to. Um, so I can talk a little bit more about each one. I mean, in terms of being common, it is the most common bloodborne infection in the United States. Um,
yeah.
so about 1% of all Americans are infected with hepatitis C. So it's
Two
about
and a half million.
2.5 million
Million.
exactly.
Okay.
And the kind of alarming thing, two alarming things about that. One is that the incidence, so the number of new cases, is going up for the first time in many years. So for a while, like when I first started doing this, I'd say incidence is down, prevalence is down, like hepatitis C is kind of fading, which was great. But then we had the opioid epidemic and a lot of new hepatitis C cases due to that. So actually, the incidence is now rising.
Mm,
So that's a concern. And then the other piece that's alarming is that only half of the people who have hepatitis C are diagnosed or know that they have it. And that really has to do with it being kind of a silent disease until the end. So
mm,
most of the time when people get infected, they don't even know, in those first days to weeks that they have the infection. And then over the years
mm.
until they get, bad liver disease, it really can be asymptomatic. So it's often called the silent killer because it can kind of lurk in your body for years and you don't know you have it. And so that's why
Right.
there's this big push to test.
Okay. Okay. And how do you get hepatitis C?
So it is transmissible through blood. So any way that you can contact somebody else's blood, you can, be exposed to hepatitis C. So kind of the biggest risk factor in the United States is through injection drug use, but it's 60% of cases are attributable to injection drug use. So it's really important to state that it's not 100%. So there are other ways of getting hepatitis C other than injection drug use. That's the one we hear about all the time. I think there's a lot of stigma around hepatitis C because of that risk factor, but there are plenty of other ways to get it. So hepatitis C is actually a relatively new kid on the block. It was
Mm.
only discovered in 1989. The blood supply only became safe in 1992. Yeah, so they knew there was some kind of virus that was causing, liver problems. We knew about hepatitis A, we knew about hepatitis B. So actually, for a while, it was called non-A, non-B hepatitis because they
Oh,
hadn't sort of isolated it. But all that happened in 1989. So again, relatively, in the grand scheme of history of diseases, it's really new. And so until they kind of isolated it, it couldn't be detected in blood. And so when there were blood transfusions going on for surgeries or things like that, it could have been transmitted then. So if you had a blood transfusion before 1989, before the blood supply became safe, then that's a risk factor. So, and any way you can think of that you can be exposed to blood. So tattoos or piercings that are done with unsanitary equipment, you know if it was done on the street or in jail, like those kinds of tattoos are at risk. And mother to child is possible, to unborn child. It's a pretty low risk. It's about 5%, but if the mom has hepatitis C, she has a low chance of transmitting it to her child. And then the other thing that's important too, and I should have mentioned this when I talked about the injection drug use, is there kind of other kinds of drug use that can put you at risk because of blood exposure. So for example, intranasal cocaine.
mm,
People often don't think about that, but you don't have to use needles to be exposed to hepatitis C. So if you're sharing any equipment that's related to drug use, so, syringes, needles, cotton, water, any kind of tool you use to transmit drugs into your nose, like if you're sharing that, there's kind of blood supply in those areas that you may not see it. It's microscopic, but you can still pass it. Hepatitis C is like a super hardy virus.
mm.
So it sticks around for a while, up to 2 weeks on surfaces. So yeah, that's important
So
to pay attention to.
So for the person that says, well, only injectable, drug users get HCV, I don't need to worry about it.
Mhm.
You say,
You say
negative, ghostwriter.
exactly right. So again, that's kind of the biggest chunk, but it's not the whole chunk. And I can't tell you how many patients. I mean, I'd say roughly about half of the patients I see who come to the clinic as new patients, and we kind of go down the whole list, like any injection drug use, any transfusions, any piercings, tattoos, all of those things, and it's like no, 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 no.
Right.
And so many times we just don't have an answer, and I think a lot of that has to do with when you think about kind of the highest risk age group, which was the people born 1945 to 1965, so baby boomers,
Mhm.
those older baby boomers, so those born more in the 1945 range, when they were babies and kids, like we didn't really have universal precautions. We didn't have disposable syringes. Those didn't come around until like the 50s. And so, there could have been transmission through healthcare before the blood supply was safe, before we were using sterile equipment. And so,
Right.
that's always a possibility. So the bottom line is anybody can get it who was exposed to blood. Some people, had exposures that they didn't know about. And so it's really important to test broadly to be able to sort out who has it and who doesn't, because we have these great treatments, which we'll talk about. But if we don't know people have it, then we can't get them to treatment.
Right. So can it be cured, like 100% cured?
95% cured. Yeah. So, but
95.
yes, so 95% of people get 100% cured. Maybe that's a better way to put it.
Yes,
Yeah.
it
So I
is.
think one of your commenters, made a really good point of this. Like, it's gone and it's not coming back, and people find that hard to believe, especially most folks we see, because it's been a silent disease, and maybe they got diagnosed 20, 30, 40 years after they actually got infected. It's hard to imagine that after having this for so long, can I actually get rid of it? And yes, the drugs are incredible. And really, once you're treated and cured, we check your virus level 12 weeks after you finish your course of treatment. And if the virus is undetectable, it's gone and it doesn't come back. Now
Mhm.
you can get re-exposed and reinfected. That's a different thing, but
Right.
most people we treat don't usually have ongoing risk factors, at least in the population I'm seeing. And so we say once that viral load is undetectable and you're cured, it's behind you. And the really beautiful thing about that is for folks who are dealing with other medical problems, this is rarely the one thing in somebody's life. It's usually on a list of 10 medical problems, and being able to cross a problem off your list and move on, gives
Right.
folks often like new motivation, like, okay, I'm done with my Hep C. I can focus on my smoking cessation, or I can focus on my blood pressure or my diabetes. So that's really empowering.
Oh, I would see that. So if it's curable, why do so many people have it?
It's really the issue of people not knowing that they have it, right? So there's no reason if you have hepatitis C in 2022 that you need to, continue with it. It's extremely easy to treat and cure. But the problem is that if we don't know you have it, like I said, we can't get you into treatment. So the really big push needs to be to get everybody should know their hepatitis C status, right? So if you've never been tested, it's really important to be tested. If you find out you're positive, you get treated and cured and you move on, right? But
Mhm.
until we sort of get a status for everybody, we're not going to uncover that 50% of people who are infected and don't know about it. And it's really unfortunate when we see folks who have had hepatitis C for years and years, and present to us for the first time with their new diagnosis of hepatitis C, and they already have cirrhosis, which is really advanced liver scarring, or they have liver cancer as a complication of cirrhosis. We honestly and unfortunately see about a case of liver cancer once every week or two. It's extremely prevalent. And so, knowing that all of that's avoidable, that if we had kind of gotten a status on somebody, 5, 10 years ago and treated and cured them, they would never go on to develop cirrhosis. So it's cancer prevention, honestly, treating hepatitis C, because I don't think a lot of people aren't aware that cirrhosis is a risk for liver cancer. About 4% chance a year of developing liver cancer if you have cirrhosis, and even once the hepatitis C is cured,
Mhm.
the risk goes way down, but that risk remains. It's about 1%, and so again, it's really important to treat before you get to cirrhosis, because then you're, not having to sign up for a lifetime of checking for liver cancer every 6 months.
Right, right, right. So, what are the symptoms of Hep C?
So it's kind of a trick question because usually it doesn't cause any symptoms. So most people don't have any symptoms at all. And that's why, they don't think to get tested. They don't, their doctors don't test them because, they don't complain about anything. If it does cause symptoms, they're pretty what we call non-specific, meaning they could be chalked up to the Hep C or they could be chalked up to any one of a number of medical problems. So kind of vague things like fatigue. Some people get a brain fog. Sometimes people get abdominal pain. The liver is kind of in what we call the right upper quadrant, so right under the rib cage on the right. And so, people can get pain there. And so those are sort of sometimes joint pains, muscle aches, things like that, mood changes. So again, all of these things that you could chalk up to something else. It wouldn't be like, oh, I have fatigue, I think it's hepatitis C.
Right,
Um,
right,
and then, it's a different story once you develop really advanced liver disease, because then you start getting symptoms that can include like swelling of your belly, swelling of your legs, jaundice, confusion. So that's kind of a different story. But before you get to sort of advanced liver disease, it usually is without symptoms.
okay. And just for anybody wondering, we have a survey that I'll put in the comments after this video that really MedIQ is looking for people to answer it. It's totally anonymous. There'll be gift cards for $100 given out. So if you want to feel like you can help, just kind of ask you some questions about what you know, which I think is great. And I guess we should say, really, to me, the biggest thing is that, and you tell me if I'm wrong, every person 18 and over should, the CDC says, should get screened for hepatitis C,
Yeah.
right?
Absolutely. Yeah. And I'm curious to see, I don't know if there's a comment section, just how many folks are aware of that. It's a relatively new recommendation, and I can kind of walk you through the history of the screening recommendations. But basically, as of I think 1998, the CDC said, test people based on risk factors, which means having to have a conversation with the patient about, did you ever inject drugs? Did you ever get a blood transfusion? And so that can be an uncomfortable conversation, both for patients and for providers. And so, needless to say, that conversation didn't happen a lot. And so in 2012, the CDC said, okay, that's not working really well. Let's change the recommendation. And so then they came out with this baby boomer screening recommendation based on the fact that 75% of all cases of Hep C were found among baby boomers. And so they're like, well, that's where the target audience is. Let's go ahead and screen that population. And that got screening numbers a little bit better, but still didn't take care of folks who were outside of that age range. And so in 2020, they came out with a new recommendation to screen everybody age 18 and up. And the kind of, it might ring a bell, 2020, there was something else going on with the virus that year. So that's like literally
Mhm.
the
Right, right.
recommendation came out right when COVID
COVID,
hit. And
right,
so clearly people were distracted. It kind of went under the radar. And so I think it might have been bigger news in any other year. So I think that's why a lot of people still aren't aware of that new screening recommendation.
right,
Um, and
right,
so that's why, that's why it's not fully implemented yet. But we could always do better with the screening. The one point I want to make too, and this may affect some of our viewers, is that the other piece of the CDC recommendation that's new in 2020, in addition to everybody 18 and up, is screening pregnant women with each pregnancy. So that
okay,
wasn't part of the recommendation before. And so, again, that's based on a high number of new cases among women of childbearing age and pregnant women, again, related to the opioid epidemic.
right,
And then this goal of testing everybody 18 and up was to capture folks who are younger than the previous, baby boomer birth cohort, where there is a high incidence of hepatitis C cases, but
mm,
those folks weren't getting captured by routine screening.
okay.
Yeah.
So Bobby Burns said a great question. I'm having blood tests next month. Should I ask to include a hepatitis C test? What should Bobby say to her doctor?
So if she is 18 years old or up, definitely.
And what if your doctor says, I don't think you really need one?
So I think it's empowering to kind of Well, that's a challenging situation, right? Because you're used
Right.
to listening to your doctor, but I think it's really important to be empowered by your own knowledge and by kind of what we call evidence-based medicine. So this is not just like, a recommendation that I'm talking about that I believe in. Like, this is the CDC and the US Preventative Services Task Force. That's the organization that makes all of the screening guidelines. Like, they say who and when to, screen for breast cancer, colon cancer. So they kind of look at all health issues and make a recommendation based on lots of evidence that, like, this is a good idea or bad idea, and different recommendations get different grades. So hepatitis C screening, for those 18 and up, got a grade B recommendation, which means that it should be done. And it also means, anything that gets a grade B recommendation from that organization is covered by the Centers for Medicare and Medicaid Services. So it's sort of
Makes
like,
sense.
this is official. We recommend that it's done, and insurances kind of follow that recommendation.
Great.
Um, so, I think in a situation where your doctor says, like, I don't think so, I mean, you can point to the evidence and maybe teach your doctor something new, that, I heard that the CDC recommends this, it should be covered. I want to make sure that I'm getting the most up to date evidence based care, and that includes hepatitis C screening. So
Right.
what we do at our institution is, HIV screening is recommended too for everybody in that age group. And so we kind of make it as automatic as possible. And so we have kind of a whole list of, these are the screening tests people are due for. Like, you're due for your flu shot, you're due for your mammogram, and hepatitis C screening and HIV screening pop up there too. And
Right.
it's really, I think, a good system, because you're not sort of asking about risk factors. You're not, kind of making random decisions patient to patient. It's like, this is recommended for you based on your age. I recommend you get it today. Boom.
Right.
And so
Right.
that's kind of the approach we use.
Well, and I think that's really helpful. I think if you sometimes we get stuck in, and like you said, with COVID happening, everything's been sort of a blur the last couple
Mhm.
of years. So that
Yeah.
comes in, and then it's like, well, do I really need it? I didn't know, tattoos. Like, I hadn't even thought about the fact
Hmm.
that that's not something a doctor's ever asked me. Do you have a
Hmm.
tattoo?
Hmm.
So how would they know necessarily if I had been put at risk?
Right.
Um,
Exactly. And that's a really important point. And that's why, the move has been made to take risk out of the conversation,
uh,
because there
Smart.
could be risks that you're not even aware of or that you're not comfortable talking about, and just making it a blanket recommendation kind of takes all of that, stigmatizing conversation out of it. And the nice thing about this recommendation too, so I keep mentioning these other kinds of screening tests like colon cancer, mammogram. The beauty of the hepatitis C screening test is it's a one-time test. So, if you go to your doctor and say, hey, I don't think I've been tested, can I get my test? And it's done and it's negative, then you don't need to get tested ever again. So it's really easy to check that off.
Right.
It's not one of those recurring things. The one caveat to that I will say is that folks who are at ongoing risk, so people who are actively injecting, or higher risk groups like men with HIV who have sex with men, that's another high risk group for getting hepatitis C. Those folks should be tested annually. But for most people, it's just a one-time test.
Yeah, that's really easy. There's very little in life that's as easy as that.
Yes.
So if we want to cure Hep C, what would be your dream? What would you want everybody to do? How would it be? How would we get rid of it?
Got it. So I do dream about this
I
because
thought you might.
I am a Hep C nerd. So there is a call for elimination of hepatitis C, from the World Health Organization. So kind of both national and international guidelines saying, like, our task is to eliminate hepatitis C by 2030, which is really right around the corner. And the thing I think is really important about that recommendation is that it wouldn't be made if it was completely unrealistic, right? And to think about eliminating a disease from the planet in that short a time frame, it just tells you that it's possible, that we have the tools to do it. And so the kind of pieces that are missing, I think it's twofold. One is we need to get, again, a status on everybody. We need everybody tested. And then the other piece is, it's not enough to just know your status. You have to have access to care and treatment where you can get cured. And so I mentioned, there's a more limited workforce than we'd like for folks who can treat hepatitis C. It's so easy to do. I mean, we didn't kind of go into the details of treatment, but basically most regimens, it's all pills. And so there's several different regimens to choose from. So they range from 1 pill a day to 3 pills a day, 8 weeks to 12 weeks for most patients. So within, 2 to 3 months, you can put this behind you for the rest of your life. And the medications are really well tolerated and really safe. So side effects are headache and fatigue in, few patients. Most patients I see, don't have any side effects.
Right.
And then the really nice situation is when somebody comes in and not only do they not have side effects, but they say like, this is the best I've ever felt in 40 years because it's the first time the virus has gone from their body.
Right.
So, the treatment is super safe and easy. We have new guidelines as of 2019 that say, you don't even need to check blood work on treatment. You don't need in-person visits on treatment. So this lent itself really well during COVID to telehealth. We could, treat hepatitis C completely remotely. And so, the treatment is as good as it needs to be. The testing capability is as good as it needs to be. And so the issue is more getting folks tested, getting them linked to care, and, getting treatment access. So those are sort of the missing pieces to achieve elimination.
Oh, that's awesome. I'm going to plug the survey. I'm going to put the survey in when we are done in the comments. But Dr. Miller, before you go, just really appreciate you being here and appreciate MedIQ for making this happen. I just so thankful for new knowledge.
Yeah, and thanks for the opportunity.
Yeah, well, tell us, where can people go to get more information on Hep C? I think that is super important when they leave here. What do they do?
Yeah, and like I said, we want people to have kind of reliable evidence-based information. So there are a few sites that have really good, very accessible. I reviewed them all just to make sure, like, is this at a good level and good for anybody to check. And so CDC has a really good website. You can just Google CDC hepatitis C. NIH, National Institutes of Health, does as well. And then the VA has done an amazing job. So Veterans Affairs health system has done an amazing job basically eliminating hepatitis C among their veteran population. It's like a total success story. And again, shows that this elimination, if it can happen on a small scale like that, it can happen on a bigger scale too. So all the tools are there. But they have a really good website as well.
Okay.
That gives very helpful kind of patient facing information. So I'd say any of those are a great place to start.
Okay. Well, thank you so much. I really appreciate it, and look forward to 2030.
Yes, hopefully we will get there.
I think so. I think so. With you behind it, we can do this.
Yeah,
Thank
thanks.
you
Of
so much.
course.
See you
All
later.
right. Thank
Bye.
you. Bye-bye.